Are you dizzy after a C-section? We have a comment here from Gaspar on one of our other videos saying that since having a C-section, it feels like she's on a boat or on a mattress. She feels this constant movement in her body, this rocking, swaying, floating, pressure in the face with difficulty focusing and neck pain. And then underneath, it does actually mention that, asking if that could be something that's more neck related, or is the neck the cause of the issue? And the simple answer is potentially yes, it could be part of the issue. When you have a C-section and there's dizziness afterwards, it's not always going to be purely a neck issue. It can be in multiple different things that are going on. So it can potentially be, say, any medication that you were taking during the time of the C-section. Of course, they have to give, painkillers, they have to give anesthesia. The anesthesia particularly may potentially have an effect of dizziness afterwards. Sometimes there can be changes in blood pressure, which is something which is generally much more normal during pregnancy and childbirth. There can also be changes for your water levels and dehydration. Dehydration, of course, is a big common cause for giddiness, but particularly if it's something which is going on more chronic, and it's something which is not just straight after giving birth, but it is something which is persisting onwards, then it's probably less likely to be dehydration. Some of the other causes may be that, just say, if the C-section was done and you were in a bit of an awkward position, maybe it puts some more strain onto the neck, if it is related to the neck. In some cases, if they had to give you air or gas, sometimes, depending on what's happening with the procedure, they may have to have a bit of an unlock or pull forward of the jaw. And as doing that, it can extend the neck a bit more up. And sometimes that can be a trigger for this dizziness that comes from this more cervicogenic reasoning, if there is an underlying thing going on. Like, say before, as an example, if you had some neck issues before pregnancy and before going into labor, it would make sense that, going through such a huge change like childbirth and pregnancy could put a lot more stress onto your body, and it would bring out some of that weakness, like, say, if there was a susceptibility in the neck. So then you'd be more likely to have more neck issues afterwards, which may then lead to cervicogenic dizziness or other types of dizziness related to the neck. If you haven't already, please go and see a doctor about this, particularly going to see, of course, the surgeon that you would have seen for your C-section, going to see any other medical doctors just to rule out any red flags or anything else they may expect, like, say, preeclampsia or eclampsia that could be more of a blood pressure issue. However, if you've already been to these people, you've already tried these things, maybe you've had a bunch of different tests and things are not as successful, then maybe trying to see an upper cervical chiropractor, somebody who's going to be assessing that part of the neck, may be helpful, because they may be able to advise if there is a problem in this area, and if there is, they'll be one of the best people in the world to try and help for it. If you are based in Singapore, of course, we're able to help, but if you're not and you're based somewhere else in the world, let me know where, and I'll do my best to find a colleague there for you.